Good morning, everybody. Sorry for the delay in getting us started, and hopefully those of you online, I can see a few comments coming in, people thinking that we weren't here, but we truly are. We're in a real room with real people, and it's so great to see everybody here today, and thanks for coming along to the Creating Compassionate Work Environments workshop, which is really going to be led by Michael. However, unfortunately, poor Sarah, and she is online. Hi, Sarah. Has come down with the dreaded, so she's not here to chair this session, so I've stepped in to chair for her, so please do be kind to me because I've joined sort of last minute to do the chairing. I was always going to be involved. So hopefully you've already by now downloaded the app. So rather than try and complicate things by having questions in the room and questions online, we're asking everybody to ask questions on the app, so please do that throughout the session as Michael's speaking, and after we've got some time, hopefully, for questions. I know we're a bit late starting, so we will try and give you the time allocated, and we're obviously going into lunch after this. So that's the app. Just move on. So before I introduce you to Michael, some of you have already completed the polls that are there. You'll be aware that the first principle of compassion is attending, being present and aware. And we wanted to run a short poll just to see who's with us here today and get to know each other about a bit. So you will see there are a poll that's live just now, and that poll will be shared. Michael West is probably, what's drawn many of you to this session this morning. He's perhaps the best known thinker and advocate for compassionate leadership, working and writing in the UK today. This is rooted in evidence he's amassed about what makes individuals and teams effective and innovative, and he's often at pains to say that compassion doesn't mean the avoidance of difficulty. He's a professor of work and organisational psychology at Lancaster University, amongst many other academic positions where we've used up so much of the time if we were to say everything that Michael's done. So I hope you forgive me for that, Michael. But his interest in health and social care is long-standing and deep. He became a King's Fund Senior Fellow in 2013 and has been writing and presenting prolifically with them ever since. He's worked with the GMC co-authoring Caring for Doctors, Caring for Patients, and his work has influenced health and social care in all 4 countries of the UK. And recently in Wales, for instance, it's led to the creation of and adoption of national principles for compassionate leadership and a hub for all the NHS social care staff. The response to COVID and its aftermath has shone a light on teamwork, leadership, resilience and compassion, and we've heard already a lot about that this morning. Today, as well as revisiting the driving force behind compassionate leadership, we'll look at how we're bearing up under that pressure and what happens to compassion under such circumstances. What are we learning? What can we do individually and together? So I'm just going to pass over to Michael now, who I think is going to take his own slides forward, hopefully.
Thank you very much, Nicola, and hello everybody. It's a real privilege and pleasure to be with you, and huge thanks to the General Medical Council for inviting me to contribute to this meeting. And this is just such a hugely important topic to address, the issue of how we create more compassionate work environments in our organizations. The pressures that we're under in our health services can, I think, fill everybody at the moment with quite a lot of gloom and doom. And I certainly feel, when I listen to the accounts of what healthcare staff are experiencing and have experienced, not just during the pandemic, but even before, it's harrowing. The pressures are enormous, and the biggest pressure is the pressure of the workforce crisis, with huge numbers of vacancies in health and social care and social work. And what we've been seeing over recent years is increasing and unsustainably high levels of staff stress amongst doctors, indeed amongst all those working in health and social care. In the National Staff Survey in England, the results published 3 or 4 weeks ago, we saw that now nearly 1 in 2 staff report that they were unwell as a result of work stress in the previous year. And that with the new measure, standardized international measure of burnout incorporated into the staff survey in England, that of the 625,000 respondents, nearly 1 in 3 report feeling burned out, or either most of the time or always at work. And that has a huge impact on absenteeism, on people quitting and intending to quit. Plus, we have all of the demands that we're facing in our health and care services because of increasing complexity, health inequalities, and so on. Plus, of course, the huge impact of the pandemic. This is harrowing. It's affecting the lives of over 1.5 million people who work in healthcare. And if you take social care as well, we're talking around over 3 million people across the United Kingdom. We must transform the way that we manage our organizations, the cultures of our organizations for now and the long-term future. It's not just about recovering from the pandemic, it's about making real transformations. And it's transforming our cultures in line with the core values and the core mission of our health and care services. You know, we know that the most important intervention in health and social care in terms of patient outcomes is being compassionate to people. And the effect sizes of compassion are truly remarkable, not only on patients and service users, but also on healthcare staff themselves when they are enabled to be compassionate in their interactions with those they provide care for. Their own well-being is improved. How do we create cultures where staff will be compassionate towards patients and service users, where they'll be compassionate towards each other, and where they'll be self-compassionate? Well, that's about the culture. And we know from the last 100 years of research on organizational culture that the most powerful means by which we can change culture is by transforming the behaviors of leaders to be in line with the core values. And the core value of compassionate leadership is key. As Nicholas said, compassion is about attending, being present with the other, listening with fascination. Second, seeking to understand the challenges, the difficulties, the pain of the other through a dialogue. Third is empathizing, feeling with the other without making it our own drama. That gives us the motivation for the fourth critical element of compassion, which is helping. So compassionate leadership means being present with those we lead, listening with fascination. The most important skill of a leader is listening. Seeking to understand the challenges they face through having a dialogue, through spending time with them, empathizing with them, particularly given the high levels of stress that staff are experiencing, and then helping them. And in the context of leadership, that means helping them to do their jobs more effectively. The most important task of a leader, by helping to remove obstacles and by helping to ensure they've got the resources they need to do their jobs effectively, the right numbers of staff, the right equipment, and the right training, and so on. And these 4 leadership behaviors, not some new model of leadership. We've known for 60 years that these behaviors are critical to effective leadership in any sector. We know from the staff surveys around the 4 UK countries that when staff in NHS organisations report that their leaders behave in this way, that's associated with the outcomes we seek. We know that where staff report their leaders behave compassionately towards them, that's associated with higher levels of staff satisfaction and engagement, the #1 predictor of NHS trust and board performance. It's also associated with higher levels of patient satisfaction, care quality, financial performance. When they don't report their leaders behaving in these 4 ways, we see staff reporting higher chronic work overload. There's lower levels of patient satisfaction, worse care quality, more errors, worse financial performance, and in the acute sector, significantly higher levels of avoidable patient mortality. So we must develop compassionate leadership and cultures thereby across our health and care systems. But it also means addressing the very high levels of staff stress and understanding how we deal with that. And Nicola mentioned the privilege that I had of being involved in working with the amazing and sadly missed Dame Denise Coyer for the GMC's inquiry into the mental health and well-being of doctors and trainees across the UK. And what we focused on was understanding how to respond to the high levels of stress. And it was clear that a lot of what goes on within our health and care services is tertiary and secondary interventions, where the focus is on either treating the end results of stress or providing sort of mollifying or ameliorating interventions like mindfulness and yoga and health and well-being programs. But what is often doesn't happen is we don't address the underlying causes of staff stress. So we're always dealing with symptoms rather than causes. And we proposed that we guide leadership across our health and care services to a focus on making sure that we're meeting the three core needs of staff in our workplaces. The ABC of core needs, we call them the needs for autonomy, belonging, and contribution. And all three must be met for people to be well and highly motivated at work and intrinsically motivated. Autonomy is about people having voice and influence rather than just feeling like cogs in the system. Having good work conditions, working in cultures of justice and fairness and transparency rather than fear and blame, having the right equipment, having influence over their work schedules and rotas so that they can balance work and home life. All of these things contribute to a feeling of autonomy and control. And the second core need, which is so powerful in human behavior, is the need for a sense of belonging, to feel valued and respected and cared for in our teams and organizations, particularly in our teams. And what we found was that in many organizations, team working is honored more in the breach than in the actuality. In the English NHS, only 40% of staff report working in teams that have clear goals and meet regularly, and yet it's a key factor in protecting staff well-being and ensuring high quality performance and high quality care. And it's also about creating cultures where leadership embodies compassion and cultures that are characterized by a real commitment to equality, diversity, equity, and inclusion. And the third need is the need that people have to feel that the work they do makes a positive difference, that they can do the work to a quality and standard that gives them a sense of satisfaction. And the key factor that undermines that is chronic excessive workload. And it's a bit like the pattern on the wallpaper, I think, that we no longer see, but it's the number one factor in staff stress, staff intention to quit, patient dissatisfaction, and so on. So we have to address the problem of workload. And I think it should be discussed in every board meeting, in every executive meeting, every appraisal, every team meeting, and that we begin to address this problem, which is causing such damage to the health and well-being of staff: cardiovascular disease, addictions, alcoholism, cancers, diabetes, depression. And it's also about supportive supervision and enabling people to feel that they're continuing to learn and develop and grow. Is this a pipe dream? You know, is it just a kind of, oh, wouldn't that be wonderful? Well, my key purpose today is to share with you what's going on around the 4 UK countries, and actually to give what for me is gives me huge hope actually for the future, at a time of real gloom and when it's hard to be optimistic. That there's much happening that should give us hope. I'm going to start in Wales, and Bwreda, colleagues in Wales. Health Education and Improvement Wales, the body that oversees health care services, is committed to a 10-year strategy for developing compassionate leadership across the whole of health and social care in Wales. They supported production of a book on compassionate leadership, sustaining wisdom, humanity, and presence in health and social care, and they're committed to translating the strategy into action. I've been working with HEIW, Health Education and Improvement Wales, articulating key leadership principles underpinning that strategy, and we're currently developing a whole range of tools in collaboration with people from across the system in Wales to support turning that vision into a reality. Much has already happened. HEIW has launched Gwella, in Welsh for improvement, a leadership portal for the whole of Wales. It's the link is there in the bottom. It's amazing, bilingual, nearly 500,000 hits and 3,000 account holders. It is the host to a huge number of networks and programs and conferences and materials and masterclasses. It's an amazing resource that can be accessible from all the 4 UK countries. It won the 2020 Learning Technologies Best UK Digital Transformation Training Programme, and in 2021 the Gold Award for the Learning Technologies Team of the Year. So it's been a real privilege to work with the team in HEIW and to continue to do so. And it has support from the very top of HEIW, hugely consistent support. And we see the emergence in University College of Glyndŵr, Wrexham. They've launched a module on compassionate leadership in practice as part of their MSc Professional Practice in Health that clinical fellows are taking, senior registrars, rotational registrars, those in clinical specialist pathways, and other colleagues in health and care taking that program. In Northern Ireland, they launched a collective leadership strategy in 2017 with compassionate leadership right at the heart of it. And they have a huge commitment to developing collective and compassionate leadership across the whole of health and social care in Northern Ireland. That work's now been going on for 3 or 4 years, and they have a clear program of how to embed this into the entire system. And I want to particularly highlight their commitment to working with universities, education providers, professional bodies, including the GMC, to introduce the principles into undergraduate and postgraduate professional training. And we also see in Scotland, Project Lift, which has been a kind of key program for leadership development across the whole of health and social care, extending into the rest of the public sector, has been focused on developing supportive, compassionate leadership. It's an orientation to leadership development that is focused on relationships. It's about relationship leadership. And it's focused on how all of the organizations across health and social care and the public services can develop a common culture. And there are particular trusts which are also taking this forward: Tayside, Lothian, Forth Valley. There are many others that are too numerous to mention. The Scottish National Leadership Development Programme, building on Project Lift, is being relaunched in August this year. And their aim is to create leaders who are inspirational, empowering, who promote well-being and understand that people are the most critical element of our organizations. In England, the People Promise that NHS Improvement has developed over the last 3 years has compassionate and inclusive leadership at its core. But it's not just a strategy. They're commissioning training in compassion for 21,000 secondary care staff and 7,000 staff in primary care. There are lots of other programs going on around England. South Yorkshire and Bassetlaw Integrated Care System has been working with Athena OD. They've developed a compassionate leadership program which has been made available to all staff working across the integrated care system, local authority, healthcare, social care, and so on. Berkshire Healthcare, another amazing example, under the inspiring leadership of a consultant clinical psychologist working within Berkshire Healthcare, it's a mental health and learning disability trust. They've been working for a number of years to train all their staff in compassionate leadership. They've now trained well over 2,000 of their 4,000 staff in compassionate leadership. And it's probably no coincidence that in the staff survey results published 3 or 4 weeks ago, that Berkshire Health, of all of the mental health learning disability trusts, came out top in terms of staff engagement, staff morale, lowest levels of staff stress. Northumbria Healthcare has been pursuing a similar strategy. They ensure that patient experience and staff experience are the key drivers of their organizational strategy. And amongst the acute trusts, they've come out as top as well in terms of staff survey data. Who else? King's Health Partners has been running a program on team working and compassionate leadership for primary healthcare teams during the course of the last year. And yeah, I want to talk a little bit as well about the work that's going on in NHS improvement. This is probably the largest culture change program focused on compassion and inclusion. It's been in development and implementation since 2015. I've had the privilege of being involved with it, along with colleagues in the King's Fund and the Centre for Creative Leadership. The aim is to ensure in organizations that we have the key cultural elements in place for cultures of high quality care and staff well-being. Cultures where there is a strong vision, where there's a real clarity about strategic goals at every level of the organization and good data provided for staff. I mentioned Northumbria. They have 700 patient conversations of at least half an hour every month and feed the data back to wards and departments the same day. They have pulse surveys of their staff every 6 weeks, and the results are fed back to the executive team by the chief experience officer at every meeting. It's cultures focused on learning and innovation, and rather than fear and blame, cultures of support and compassion and equity and inclusion and team working and cross-boundary working. That program has been developed over a number of years. As I said, the key cultural elements are translated into leadership behaviors and linked to the outcomes we seek. It's a publicly accessible program. The link is on the bottom of the page. It has an extensive range of tools to support the development of those cultures. 4 phases: scoping, discovery, design, and delivery. It was co-developed with 3 NHS trusts, and the aim of the program is to help organizations integrate the tools involved in each of those phases into what they're already doing, and then to have a much more powerful approach to developing and sustaining culture. The King's Fund, where, as Nicola said, I have an appointment as a Senior Visiting Fellow, has an online digital program, an introduction to leading with kindness and compassion in health and social care, available. It's a free online digital course. It's available to anyone working in health and social care, leaders, to students, to patients, service users, or carers. And that was launched earlier this year, and take-up has already been in the several thousands. One of the really inspiring programs I'm aware of is a compassionate leadership course for foundation doctors, developed, particularly led by Dr. Alison Sykes and by Paul Bates in the Northwest Foundation School. It's an 8-week course, 1 afternoon each week. They focus on compassionate leadership, self-compassion, compassion in teams, compassionate leadership in challenging situations, and I've had the privilege of contributing to that program. It's co-designed by the Northwest Foundation School along with Lancaster University, and the results have been really, really encouraging. Positive impacts reported by foundation doctors, and yeah, really a sense of increased engagement at work. One person reported that it had profoundly changed their experience of their profession, and the stories that are coming out from that program are really inspiring, and they've really helped me remain incredibly hopeful during what's been a hugely difficult time. Further foundation courses are being implemented, and there's now an instructor's course so that the course can be delivered within people's own organizations and trusts across the NHS. I think one of the key components that virtually all of those initiatives that I've mentioned is a focus on self-compassion as a kind of fundamental element that we have to get right, because healthcare professionals and doctors are often kind of recoil from the idea of self-compassion, but it's of course at the basis of our ability to be compassionate towards others, and the development of a knowledge about the importance and centrality of self-compassion in our ability to create these work environments, I think is hugely important. So, I mean, in summary, as I said, I'm really inspired by all of this work that's going on. What we see is there are lots of dark spots across the system. The staff survey results I've referred to that came out 3 or 4 weeks ago were very worrying in terms of increasing levels of staff stress, but there were clear light spots as well. And what I've just presented to you, I hope tells you about the fact that there are some really bright light spots across the system. And our challenge for the future is how we reduce the variability and raise the overall level of illumination. And I think that's the responsibility of all of us who work in health and social care. So thank you all very much for listening. And Nicola, thank you for giving me this opportunity. Thank you all.
Thanks, Michael. I hope the sound problems have sorted for those online, because I believe there was some messages about it being echoey, so I hope you can hear. There's a poll on the app which asks about the extent do you agree current plans, so all that wonderful work that Michael has outlined, but how is that actually getting down to the ground? You know, we saw from the earlier polls that, you know, we've got some doctors in training and others in the audience, and you know, how actually is that getting to colleagues on the ground? And unfortunately the poll so far is saying that only 7% agree that this work is actually making a difference to those on the front line. So I think that's something that we might want to reflect on, Michael. There are a few questions coming in, but I thought first of all probably helpful to share a comment from Christopher Jones as chair of HEIW. He said there's never been a moment in time where the opportunity and need for compassionate leadership is needed to heal and innovate our care. Michael's work has been inspirational, so I think a real good endorsement there for you, Michael. Now down to the hard questions though, and please do keep sending questions in. We've got sort of 10 minutes or so. So the first question that's been flagged to me is, you know, a lot of the schemes that we've outlined are felt to be led from the top, and are there opportunities for more bottom-up initiatives as well?
So it's a really important question, and I think that, of course, it's something that's in all our gift. All of us can choose to be present with others, to seek to understand the challenges they face, to empathize with them, and then to ask how we can help. I mean, it's an inborn human response. Evolution has selected compassion as a really important, you know, inbuilt human response. And all of us can choose to nurture the capacity in ourselves in order that in our immediate work environment, we help to create more compassion. So that's something we all can do. The culture and leadership program I described in NHS Improvement, it's deliberately designed to be owned by the whole organization. So rather than it being a program that somebody imposes, in all of the organizations, there are about 80 organizations now that are taking it forward. The program is led by a change team drawn from across the organization. It's absolutely right that what we found is that it must have the support of the board at the top in order to ensure that there is, if you like, legitimacy and power behind the change. But the aim is that it is a program that involves everybody across the organization. So it's focused not just on developing formal leaders, but on developing the leadership skills of everybody across the organization. Because, you know, one of the, I think, real hindrances and paradoxes of our healthcare systems is we have the most skilled, most motivated and largest workforce of anywhere in industry, yet we continue to manage people largely through command and control with extended hierarchies. So the purpose of this program is to develop everybody's leadership and team-based working so that we begin to move away from that hierarchy and give people autonomy and control and a sense of belonging and competence also. So it's absolutely right that this needs to be not only a top-down process, but owned by everybody. But we can all make a difference.
Great, thanks for that, Michael. Another question here is around the pressure in the system. There's never, pressure in the system with a lack of time and resource commitment. There's a sense of kind of fundamentals like creating belonging and being a bit indulgent. So how do we actually convey the importance and really truly get that buy-in? Because, you know, I'm guessing a lot of people in this room today where you're probably preaching to the converted, they're interested in leadership, they see the benefit of it, but how do we get that message across to maybe those that are looking for other priorities for us to focus on?
Well, you know, the short answer, Nicola, is present the evidence. As I said earlier, what we know is that where leaders behave in this way in organizations, subsequently in those organizations, what we see is better care quality, better financial performance, higher levels of patient satisfaction, more staff retention, lower avoidable patient mortality, fewer errors. I mean, what else would we, what other kind of intervention is there that produces those outcomes? And so for me, there's something about presenting the evidence, but it's not just presenting it once, it's presenting it again and again and again and again, so that we get the message across and that we begin to change culture. And presenting the evidence of the outcomes of programs like Berkshire Health's program and the work going on in Wales and the Culture and Leadership program. We know that Culture and Leadership program is associated with higher levels of staff engagement, better care quality commission indicators of outcomes, and NHS Improvement's own indicators of organizational performance. So I think it's about presenting the evidence and making the case clearly again and again and again.
Thanks, Michael. I mean, there is a comment in as well about how what would we say to how those who are critical of the efficacy of those projects at building competence in leadership. And I guess you've sort of answered that by mentioning about continuing to share that evidence. But I think the reality is that there are people out there who are not convinced by it, and that the leadership is the answer. We're obviously part of our review of good medical practice is looking at how we can further make those points noted. So any sort of thoughts on how to deal with the non-believers, I guess?
We've got 100 years of research on organizational culture and changing organizational culture across the world. And that shows that the most important intervention is leadership. And we also have all of this evidence about the kind of leadership that produces the outcomes we seek. So there's something about continuing to present that evidence again and again, and making the case.
Okay, thanks, Michael. So there was a question from Rachel. I don't know if you can scroll down a bit. The questions are coming in thick and fast now that I thought I would flag for the next one. Okay, here we go. So how can the medical system support those who are neurodivergent, disabled, have long-term conditions? Oh, and it's moved again. So sorry.
Well, I just want to make another comment about, about making sure also that I know the GMC is committed to this. I know Health Education and Improvement Wales is. It's about how we also incorporate this into postgraduate and undergraduate education, so that we, part of what shapes the culture is the new people joining organizations. And the more we can embed compassionate leadership and good team working skills for people in their undergraduate and postgraduate education, the more we begin to shape the culture. And I see that move beginning to happen now across Scotland, from NES in Northern Ireland, Wales and Scotland. But we must maintain the momentum and persevere, so that, we're changing the culture in that way too.
Yeah. Okay, a question here about when the system creaks, it seems harder. Sorry, my screen just left. When the system creaks, it seems harder for leaders to be compassionate. So how can we again, use that, the sort of opportunities to highlight the importance of leadership when there's such a focus on waiting times and the A&E, backlogs and all of that? So how do we create that conversation?
Do you know what feels absurd is the biggest crisis we face in our healthcare system and in social care, but the biggest crisis we face in healthcare, and it's not unique to the United Kingdom, is the workforce crisis. And it's not just about recruiting people, it's about retaining people. 1 in 4 nurses leave the NHS within 3 years of joining, and we see an aging workforce as well. So that's the biggest crisis that faces us. If we don't respond as leaders to that crisis, then we are going to be in more and more difficulty with waiting times and with waiting times in A&E and with readmissions and so on, because that's the number one issue that leaders should be focusing their attention on. And that's, I think, agreed in many countries around the world, that's the crisis there. United States, in the 4 UK countries and Western Europe and so on. And so it's a burning platform that we have to be aware of and respond to. And also, as I said, those outcomes are not achieved by just focusing on targets and numbers the whole time. You know, senior leaders, executive team leaders, senior leaders, probably the only thing they really influence is culture. And if they're not working on influencing the culture, then it's probably managing them. So when people spend their time myopically focused on targets and numbers and so on, in the sort of mistaken with a mistaken assumption that they've got control over all that, they're missing the point. The role of senior leaders is to manage the culture of the organizations, thereby enabling the staff, this highly skilled, highly motivated group of people, to do their jobs effectively and to deliver those outcomes that we seek.
Thanks so much, Michael. We have so many questions in the chat, but we've just run out of time to answer them. But please do keep sharing in the online questions. Michael, it just really leaves me to thank you so much for all your wisdom and words this morning, and I'm sure we will have many further conversations on this important topic. And I'd just like to thank all of you online, those that have had to deal with some of the tech difficulties, but also those of you in the room. It's been fantastic to see so many people here, and really it's up to us to kind of go out and share the message. But for now, it's lunch, so time for lunch and then back to the workshops this afternoon. Thank you very much.